So that 40 transverse detent. First one is a femur. Thank you. Correct way. All right. I'm gonna go ahead and line my buddy up and get this set.
Sorry, ma'am. I'm sorry.
All right, we need a femur. So my first one I'm gonna do, I'm gonna feel for ACES, put the top of my light field at ACES, and then this line running down the leg. Okay, now, that will not be normal pressure, that feels good.
Yeah, it did.
Okay, I can do some collimation there, right? See, all I need is a femur right here, so show a little bit of collimation. I need a 15 to 20 degree internal rotation to make it an AP. Right marker. Can't shield. Too much light. I could if I do this, but I don't want to clip my femur off, so we're just going to show collimation. Hold your breath. Beep. Now this is DR, so I'm not changing the cassette. All I'm doing now is I'm going to find her knee joint, which is right here. I'm going to make my light go just a little past it to make sure I definitely have 2 inches of overlap. I need to release this because this is only 5 degrees. And now I can shield a little bit, right?
Mm-hmm.
Just place that right there. Hold your breath, beep. So that was an AP of the top, AP of the bottom. Now I need you to roll over onto your right side. Okay, about a 45 degree bend there. And look at my patient, just sticks her leg right in the center it should be. Right, and I can collimate in a little bit more. It's past the knee joint. This one I can shield.
And the top of the light field there, it doesn't need to go up.
No, because I'm doing the bottom half, so I'm worried about this. The next one I'm going to worry about that one.
And you wouldn't really like, if this was ended like that, would you be worried
It'd be
about
okay
that?
because you're going to have overlap.
Okay.
On a normal picture, that would not be okay, but
Right.
because we're going to have this much overlap, it would be okay. Okay, don't move. Beep. Leave her in the same position. And now I need the top of the femur, so there's ACES. Got ACES. A little bit of light back there on the thigh. Right marker. Beep.
What position is this?
Lateral upper femur. So we did AP upper, AP lower, lateral lower, lateral upper.
Wow.
Okay, on your back. Next one is a AP pelvis. So it's a 14 by 17 landscape. And the cheat, which makes life easier, is just top of the light field at crest, right there. The central ray, the way the book says it, is your light field is midway between crest and pubic symphysis. So right there. So it's a little off, but top of light field of crest, it works. I like it better down here.
Oh, you could take the sticker off of the stick.
What do I need to do before I say beep?
Excellent.
Yep. 15 to 20 pigeon toe. Hold your breath. Beep. All right, next is a
Flat
hip
on.
x-ray. So these are on a 10 by 12. Just one little small hip. Central ray is mid-femoral neck. So I'm going to start at ACES. I'm going to go 1 to 2 in, 3 to 4 down. There it is. Her leg is already in 15 to 20 degrees. I've got room for a marker. Hold your breath. Beep.
It's right hip.
Right hip.
It's down on 14.
10 by.
10.
If you only need one hip, one little cassette will get it. You need both. You need the bigger one. Now I need a lateral of this hip. So she's going to bend her leg up. And then we're going to drop it out 40 to 45 degrees. So not all the way down. And my central ray is mid-femoral neck. So it's in the exact same place.
So you just arch that leg?
Mm-hmm. It's called abducting 40 to 45 degrees. Because if she was up like this is abduction, right?
And you put marker on the actual leg.
Yeah, because I don't have any on the table. You have to.
And this is the frog leg?
Mm-hmm. Modified cleaves or frog leg. Lateral hip is what it says on the paper. Hold your breath. Beep.
Lateral hip.
Okay, now let's say we needed this, but of both hips, when we could get it all in one picture. So I'm going to go 14 by 17. Central ray is 3 inches below ASIS and down the middle. So now if you will do the same thing with this leg, heels together. And go. Ooh. I'm not down the center, am I? It's like if I have that much light on that side, I knew I wasn't down the center. She's little because so she's got light there. Most people are not gonna have light there and you're gonna have to stick it on top of them.
Oh, we just stick it just.
Right there in the light field. Hold your breath, beep. It's a funny pose. All right. Okay, so now we need to look at her bilateral pubes and ischias, so straight legs. We're gonna get perpendicular to the pubes, which sit like this, and she's a female, so she needs 30 to 45.
And males is 20 to 35.
Yep,
30 to 45.
for
So if you do
females.
30.
30 on everybody. That's good. Oh, look at that, right on there. And my central ray is 1 to 2 inches below pubic symphysis. Now, I was telling the last group this can be kind of confusing, but we learned that the greater trochanter and the pubic symphysis, what's the difference between
1 inch above.
1 inch. So right now I'm feeling her greater trochanter. So if I go down an inch, now I'm at her pubic symphysis. Okay, but the central ray is 1 to 2 inches below pubic symphysis. So I'm gonna go there. Legs don't matter on this one. This is the outlet. Legs don't matter. Hold your breath, beep. Now I need an inlet, which is on a 14 by 17, and it's 40 degrees caudad for everybody, whether you're a man or woman. Oh, no, the slide not that way. Lining up right there. Still in D10. And my central ray for this is at the level of ASIS. Put it right at ASIS. Look how huge the light field is.
Is it 14, 17?
14 by 17.
Every time you touch me, there it tickles like crazy.
Your
It's like,
ribs.
You just poke me and I'm like,
You said central is at ACEs?
Mm-hmm. Here's ASIS right here. I mean, it's midline at the level of ASIS.
Okay. Looks like your target's
Yeah.
not there.
My target. All right, so this is, we're going out for the inlet. 40 degrees caudad for everybody. What's next? Acetabulum?
Posterior oblique.
Okay. So that one is a 10 by 12. Oh. 12, 10. Okay, let's say that the radiologist wants to see, don't move, a fracture of the right posterior brim. What position should she go in?
LPO.
Okay, because we just want to see the posterior brim, so stick it up, 45 degrees, lay back. All right, now I'm looking at the upside. So my central ray, I'm going to start at ASIS,
2 inches below.
and I'm just going to go 2 inches inferior. So
That's
this
so
is
easy.
for a right posterior brim. Now I could leave her in this position and see something else. What could I see on the other side?
R. You're the right
Left
anterior.
anterior, left anterior,
Okay.
which my central ray for that is start at ASIS, go 1 to 2 in, 1 to 2 down. All right, 1 to 2 in, 1 to 2 down, right there. So then I've got to use a left marker because we're looking at the left side. Hold your breath, beep. So this one position can demonstrate both sides.
In the comp, are we gonna do?
No,
both
you're
in
just gonna do one. I would say if you got this, you would pull out of the bucket left posterior brim. And that's when you go, oh, no, anterior brim, sorry, left anterior brim.
Bonus points if we do both.
Good one. You're like, no, I was serious. Okay. Next one.
Axiolateral hip.
We want to do an AP hip, which is this. Beep. We did that. We want to do this, but she goes, ah, it hurts. I said, okay, let's just leave it down there, ma'am. I'm going to turn the light on and we get to get all creative here. So I'm going to take my grid cap with a cassette in it. And here is her femoral neck. Sits at an angle like this. So I'm going to take this, my cassette, and just kind of shove it up in her side to get it parallel with the mid-femoral neck. So it's not flat against there. It's angled with her neck. I get this around here. I'm coming over there. Okay, I've got to get my central ray perpendicular to that image receptor right there. So how we get it perpendicular? This is going to have no tube angle. Hi, how are you? What?
When I'm recording, so I'm just like.
Okay.
Trying to creep behind you.
I'll be done in like 3 minutes. All right, now we're gonna have this leg that does not hurt stick up on here. Now here's the thing with this tube. I need to penetrate her thigh. You see my central ray right there? I'm not penetrating her thigh. I need to be down here. So the only way I can do that is to take this, drop it down the handle under the table, but now I'm not facing that. So this is the first time we're gonna use this lever back here, and I'm gonna loosen this lever so that I can push this tube in that way.
That's a lot. Oh
Yeah.
my God.
Now I gotta find her midfemoral neck. So here's ACES, so it's 1 to 2 in, 3 to 4 down, so that's where I need to be. This is like an octopus picture. Thank you.
What is that you're pointing at?
That
No,
is
neck.
where her midfemoral neck is, and that's what I wanna penetrate.
Because she went to the ACEs. 2 inches.
Number 2 in, 3 to 4 down.
Oh, yeah.
So now I'm penetrating right in there, and I'd put my right marker right up there in the light field. 15 to 20.
What did that lever do again?
The lever